Hello. I want to say first congratulations to the Preconception Care Center for your 10th anniversary, and congratulations to the Women's Integrated Center for your first anniversary. That's really exciting. I wanted to say I'm very honored to be here today, and thank you very much, arigatou gozaimasu, for the invitation. And I also want to thank the translators who are doing a great job. I also want to say that all of the things that I say are my words and do not represent the University of North Carolina. So we also do not like the word preconception, and I'm sorry that you couldn't come up with a better word either. Our definition of preconception is very similar to yours, which is that we want all people of reproductive age to be as healthy as they can be and to have a healthy life for them and any children that they may have. The picture on the screen was part of a project that we did where we asked different people from different cultures to take a picture of what preconception health meant to them. And this came from a Native American community, and it shows all of the generations. It shows the baby, the mother, the grandparents, and then you can see the great-grandmother. And so preconception really is intergenerational. And it matters. We are still making the case for why preconception health matters in the United States. For us, we have a very high infant mortality rate. It's about 6.8 per 1,000 live births. And for Black babies, that can be up to 15 per 1,000 live births. So we know that preconception is so important to prevent prematurity and birth defects. We also have a maternal health crisis in America, and we were getting a lot of energy for this. And would have had a lot more, but we are now seeing reductions in funding for maternal mortality, but our maternal mortality rate is 32 per 100,000, and it's even higher for Black women. So we also know that being healthy before pregnancy is incredibly important for healthy mothers. And finally, as you say in your country, we know that when young people are healthy, they're better able to learn and work and age well. So we also have shared challenges with you in Japan. Mental health is a very critical issue in the United States as well, and we also have high rates of suicide and depression and anxiety among our young adults. We also have disparities by race and ethnicity, and you also have those in Japan, with some of your populations have worse outcomes than others. And we also know that by education and poverty, the less educated and the poorer you are, you also have poor outcomes in our country and yours. With nutrition, our problem is overweight. But we also are seeing negative outcomes. We also see many issues related to menstruation that have been overlooked and ignored, and many women suffer for that. We have later childbearing, not quite as late as Japan, but close. We don't know a lot about pre-pregnancy health, and we also have increasing chronic conditions. So we have a lot of issues that we share. And some that we do not. And I will say we've had a very interesting year in the United States and are seeing some changes in policies that I think are not going to be great for mothers and babies. Some of them relate to access to prenatal care, which worries me. If we can't do prenatal care, how can we get to preconception care? We are seeing some changes in access to health insurance, and unemployment is increasing. We also have less funding to do programs for certain groups that have the highest risk. So now we need to do it for everyone, and that's very expensive. We also have less access to childcare, which is a very big crisis in our country. It's expensive, it's not available, and is leading to problems with child welfare and child neglect. We are also seeing and have very big concerns about a decrease in access to contraception. Some of our federal funding for contraception is at risk, and in some states, abortion is illegal. And the result of that is poor outcomes for women. And also now we have a big distrust in public health and vaccines. So do not do any of this. This is not going well. And it's unfortunate, but we will ganbatte. We will keep working, and we will continue to do work. So I wanted to talk about a few strategies for improving preconception health. The first thing that I want to talk about is the importance of data and surveillance. And there's a really exciting international initiative that's happening across all the globe, where we are trying to identify a core set of indicators or data points so that we can compare countries across the globe. And I want to note that Dr. Eri Maeda, who spoke earlier, is the lead for Japan, and I'm helping with the United States. And I think this will be very exciting. So also when we look at outcomes for programs, we can be looking across the world. I also think your new data center is very exciting. And you have some very exciting new programs that will happen with your new preconception care plan. And I think that if you evaluate those well and look at your data, that there's a lot that you'll learn in Japan that you could share with the rest of the world. So really encourage you on your evaluation as well. Having really quality clinical care is also important. And for this, we have some things that are very common in Australia. So we also have encouraged an annual preventive health visit, which a good preventive health visit is essentially good preconception care. And we obviously need health insurance to have an annual visit, but also that visit needs to be quality. And we find that young adults, if they go to the visit, may not know that they have a problem or may not know what questions to ask. So screening is something we've been trying to implement for many years so that the person can be able to show where they might need more help, and that makes very good use of a visit. So, and there is research on screening, so that might be something to think about. And then when there is a problem that's identified, we've also found it's so important for doctors to make a plan with the patient so that she understands the plan. It's easy to say you have high blood pressure, you must lower it. But if you don't get any guidance about how to do it, it's not very helpful. And finally, it's important that women's concerns are taken seriously. I thought the example from dentistry with the woman who went to so many clinics to get help for her pain is a great example of how many women suffer and often are told it's not important, it'll go away. And I think we have to really listen to women's concerns and take them very seriously. We also have a lot of work to improve chronic condition care. It's very exciting here that you have specialists in endocrinology and in chronic disease, because many times care for maternal health and infant health that is very separated from specialty care. And I think that we really have to work together, especially because women with their chronic conditions are at the highest risk for, in my country, maternal death and sickness, but also for infertility and other poor birth outcomes. And what we found is that women with chronic condition are often never asked if they want to become pregnant. And so they may be taking medication that keeps them from their goal of becoming pregnant. We also need care coordinated across specialists. So we have found in research that women feel like a hot potato. I'll explain. So the OBGYN doesn't want to take care of her diabetes, so she goes to the specialist. The specialist doesn't want to talk about pregnancy, so they send them to someone else. And so meanwhile, she never gets really good information. So that coordination is important. And also for us in the US, I'm encouraging that we focus on the most common conditions like hypertension, heart disease, diabetes. So one project that we have been working on in the US is supporting women with PCOS. And we have all of the resources are available at the website that's listed there. We have developed training for GPs because we found that many women were not being diagnosed with PCOS and were suffering a lot. But some of the GPs didn't know how to diagnose it because it's not the easiest to diagnose. So we have guidelines and algorithms. We also worked with patients to create educational materials, and I will show that in the next slide. And we also have provided care navigation. So I want to talk about this for a minute. It can be very hard to make lifestyle changes. It is not easy to quit smoking. It's not easy to quit drinking. It's not easy to exercise. And I was surprised about the data in Japan with exercising. I thought you were super Genki, but anyway, it's hard to just start exercising. And so we have care navigators, and those can be nurses, community health workers, or they could be other women. So we say peer-to-peer support that can really walk with someone as she's trying to improve her health. And we have found that really helps people make change much quicker. So this also has been discussed a lot today, and I'm excited because life course approach means that we don't just care about her when she's the middle picture or maybe a little younger, but that we know that how menstruation starts, that understanding your body all the way through your life course is really important and can address also mental health issues and help understand how each part of our life layers on the next one. In the United States, there's currently a lot of interest in menopause. So we are trying to get the energy and tailwind that down to preconception and to also care for girls. So maybe in our country it's going to be older women that finally get women's health equity. But we think if we could provide guidance about what to expect at every decade of a woman's life, it could be really helpful. And also we really need to support research on women's health, and I'm so excited that's part of your integrated center. And again, please publish your results because we really need more research. When it comes to mental wellness, there's a lot we should be doing. We in the US are trying to create programs that connect people with each other, not on their phones. So maybe it's because of COVID, but we found that a lot of young people don't come together in person, and I think are very lonely and very driven by what they see on their phone. And so we're finding ways to build relationships again. Making it easy to find professional mental health services is also important, and taking away the stigma that something's wrong with you if you need mental health. I do think our younger generation is more open to talking about mental health, at least in the United States. So I'm hoping maybe that generation will help get rid of some of the stigma. We've also been thinking about teaching stress management at work and school and in communities, and making sure medication is available and is paid for is also important. And finally, this is the hard one because people are very stressed out right now in my country. But we have to get away from just that mental health is this one person's problem and look and see what is it in society that's increasing the stress. So if you see stress in schools, at some point we have to think about what's making school stressful, and the same thing in work. So the last thing I wanted to talk about is really health education. I know that's an important part of the Preconception Care Center. And it can be really challenging with preconception health because there's so many people and you want to reach them with different messages across many decades of their life. So it's hard. But my suggestion is that you start by talking to the groups that you want to reach and you listen to their ideas. I know many of us in this room, we're all smart and we come up with good ideas, but they may not work because we never created them with the people that we wanted to serve. So we've started designing all of our programs by listening to people that have the experience that we want to serve, and it has made a big difference. We've also had them design educational materials with us. So we try to use the words that they use and the pictures that they want. And that includes hairstyle, dialect, and even the images around them. So I would encourage that because it matters. TikTok and video reels, I mean, attention is very short, 2 minutes, 3 minutes. So we have to adapt and give our messages one at a time in a very engaging way. And also thinking about influencers and thought leaders. So who is thinking about getting pregnant? I feel like Taylor Swift is going to be great for preconception health someday in the United States. But thinking about how you can get the message to people that have already got the attention of young adults might be helpful. I also wanted to suggest that you go where the people are, and I'm wondering if some of you might want to be physician influencers. So I have a slide. There are 2 that I would suggest you follow. So the period doctor, she is Dr. Chambers. She's from the US, and she is amazing. She does a lot of conversations around menstruation, reproductive health in a very real way. And she also has videos that work for mothers and parents and also educate them, because sometimes parents and mothers don't have good information either. And we found that sometimes if a mother has experienced pain with menstruation for her life, that's what she thinks it is. And she may not know that pain isn't part of menstruation. So Dr. Chambers is very effective with moms and with young adults. And then I also got to meet Dr. Noella, who is from Cameroon in Africa. And she has a YouTube channel, and she is amazing and talks to community health workers and women all across Africa. So maybe you want to be a physician influencer. We also found it's important to be flexible with your messages and to make preconception health fun. And the information that you provide, make it actionable. When we just tell someone to eat healthy or exercise, where do you even start with that? So thinking about giving something that people can start with that's a small thing is a good strategy. Here's an example of some of the materials that we created with women, and I wanted to just point out a few things. So for the first one with Your Mental Health Matters, we wanted to highlight that, they wanted to highlight that mental health is important too. And at the bottom it says, you are not alone. And we provide information about how many other people are struggling with stress, anxiety, fear, and sadness. And that's important because if someone's struggling with the mental health, they may feel like they're the only one. The same thing was with PCOS. You'll notice at the top that the women said, you are not alone, because they also didn't want to feel abnormal with their condition. You'll see that they used a lot of images to help describe different problems. And at the very bottom, it says, knowledge is power. And again, this is the idea of when we're giving information, they want it positive, they want to feel like encouraged, and that it can be better. And that's not how most of our educational brochures are written. So this is our website, showyourlovetoday.com. We're keeping it alive. We also need money, so but that's the national website, currently funded by me. Also wanted to talk about another area that we've been talking about in the United States, which is how do we engage men in the conversation? So there's growing evidence of male influence on birth outcomes, and there's a lot of debate. I think people debate in the U.S., do we want to put money in something that helps men's health when women's health has so many problems? But if we engage men in a conversation, does that change the dynamic? So it's not all of the blame is on women if something goes wrong. So I think as we engage men more in asking them if they want to be fathers and when they might want to be fathers, and really encouraging them could be something that might change the tides a little bit. And I do think that it could reduce blame on women potentially. And we're going to talk about that in the panel. And then the last thing I wanted to talk about, which I wish that we could do more of, but I really think starting to talk with adolescents of all genders about their reproductive health is really important. And for this, we're going to look to you in Japan for this. We were able to do some work and some presentations in some high schools in North Carolina, and we were talking about the hormones and biology, and the students loved it. They were very interested in how their bodies worked, very interested. We weren't able to sustain it because parents, I don't know, parents are complicated in the United States. They have a lot of opinions, and I don't know if they thought we were trying to tell them to all get pregnant and have sex. I don't know. But this is a little problem we have in our country. But I think if we start young and we also educate on things like hormones, and we educate, again, not just at menstruation, but across the life course, I think it could be very impactful. And I was thinking about the presentation with the full nest. And so if you have a full nest and you have adolescents and their mother is going through menopause, they might want to know about menopause because they're living it. So I think that there's a lot that we can do with talking to young adults. And there is some work that's happening in the United States called the partnerpeptalk.org that is trying to start this conversation. And I was trying to talk slowly. So that is what I had to say, and we'll have more to say during the panel presentation. Thank you so much.